what you do and your part of this organization is.
So I'm Jeffrey Taub. I'm the head of oncology at Children's Hospital of Michigan. I've been treating children with cancer for over 20 years. And we're having a lot of success treating children with cancer. We have lots of patients who are long-term survivors. And overall, we probably have cure rates of over 80% in 2016. But the one thing we have never addressed is, why did children get cancer to begin with? And if we can identify why children get cancer, maybe we can even offer some type of interventions to either diagnose it early or even some prevention. So one of the things that I always face whenever I diagnose a child with cancer, the parents always ask, why did my child get cancer? Could we caught it earlier? Could we have prevented it? Can my other children get cancer? And the area of cancer that I really focused on as a career is treating children with leukemia. It's the most common form of cancer you see in children. And that is something that I've been really interested in for quite a few years, is what causes cancer, but particularly what causes leukemia in children. Does it take a couple months for them to develop leukemia? Or does it take a couple years from whatever causes the initial cell to become cancerous until they're diagnosed with leukemia? And that's where I started thinking about, are there things in the environment that could potentially contribute to children developing cancer? And sort of looking at the cancer field, what other people have done. Nobody has looked at some of the things related to exposures, but noted that people use this animal called a zebrafish. And then sort of say, well, maybe we could do something with the zebrafish. We can maybe sort of think of some project and then sort of see what resources are available at our own institution, Wayne State University. Came across Ryan Thummel as a colleague who was doing zebrafish in a completely different line of work. And over the last couple of years, we would meet, talk, and then sort of came up with this whole idea about using zebrafish as a model to study what are some of the roles that people may be exposed in the environment, whether it occurs when a woman is pregnant with the fetus, and that maybe there might be exposure that occurs when she's pregnant that maybe could trigger her child to ultimately develop leukemia, or it might be something that happens after a child is born that occur in early childhood in terms of exposure. And the thing that we have focused on is the role of pesticides that people in the general community can be exposed to. But there's been some studies that suggest that pesticides may be linked to children developing cancer, particularly leukemia. And that's when we started this project looking at the role of pesticides, which can trigger the development of leukemia in children using this really unique model of zebrafish.
How in the world did the connection, was the connection made between the zebrafish, though, in this?
So nobody has actually ever studied, up until our initial project, using zebrafish to actually expose zebrafish to pesticides to see if they develop leukemia. So it's been a long process to sort of look at what other people have done and sort of see that can we sort of modify things and come up with some new novel ideas. So we've been able to develop a model of human leukemia that can develop in a small number of zebrafish. So that why would zebrafish, which is not a human, develop something that looks just like human leukemia, is that their blood cell development is similar to what you see in humans. So that's really novel in terms of having an animal that can develop a cancer that looks just like what you would see in a child. And so just developing that model in terms of having a specially genetically engineered zebrafish that has a human leukemia gene in it, and then having those zebrafish, when they grow up, a small percentage developing leukemia, took a number of years to sort of perfect and sort of tweak to sort of get the right conditions, because nobody else has ever done this. So that's taken a lot of process. It was a long process, but we've gotten to the point now that we think that our model now is really ready to go prime time in terms of really studying lots of different sort of combinations, including pesticides, but doing it in thousands of fish all at once in a specially designed laboratory.
And what kind of results have you seen or do you expect to see?
So what we're expecting to see that it's very likely that children who develop cancer, they may have some type of predisposition, but it's probably several things that have to play a role for them to develop cancer. They probably have a genetic predisposition where they may have inherited certain genes that may put them at risk for developing cancer, but that by itself is not sufficient. That having this predisposition, but then having some type of exposure, sort of the final trigger. So that's what we're using for the zebrafish. We're having the zebrafish that has the genetic predisposition, which we feel is one of the factors, but then what is the trigger? And that's where we're using the pesticides to see if we can accelerate or increase the number of zebrafish who actually develop leukemia if they have the gene that can predispose them to develop the leukemia to begin with.
How enthusiastic are you about this?
I mean, I've been working on this for several years, and it's been really challenging because it's sort of a side project because I take care of children. That's my full-time job. Doing research is sort of a part-time, in your spare time project, but I think that we owe it to the patients we treat and also to the parents that not only treating them, we have to sort of come up with some of the answers. I'd like to ultimately be able to go to a parent and sort of say, because of research that we were able to do here at Children's Hospital Michigan and Wayne State University, that we were able to make some important contributions to really sort of say, why did this child get leukemia? But ultimately, I really feel that if we can identify some causes, we can do some prevention. And I think that would be great. If we can prevent children from getting cancer and having to go through all their chemotherapy treatments, that would be the ultimate goal. But I'm really excited that I think that we're on the brink of being able to really expand our project, having Ryan Thummel and then a new colleague, Dr. Tracy Baker, as another zebrafish researcher, and having this collaboration between PhD research scientists and people who actually treat children with cancer at the hospital, that collaboration is really important. And the fact that we have facilities that are very close to where we all work so we can meet and discuss and collaborate well.
As the doctor who sees these patients and these families go through this, what would it mean to you to be able to say, I think I got this, I think I can?
I think that would be the ultimate goal because, obviously I have successfully treated a lot of children with leukemia and cancers over the years, but if I could ultimately sort of say, like, I'm not even going to have to treat them, I'm going to be able to prevent them from getting cancer, that would be the ultimate goal. And that's a challenge we face. A lot of adult cancers, we sort of know what causes them, smoking, sort of lifestyle exposures. Children, they develop cancer at a very young age. And it's not something that they have themselves done deliberately. No, it's just something that they have potentially been exposed to. But obviously we have a small window that we can actually do some type of interventions, and I'm really excited that that is what we ultimately are striving for.
You must be so proud to be part of this.
Yeah, no, it's exciting, and I think I'm just lucky that at our own institution, Wayne State University, that we have other people who have expertise and that people are interested in collaborating, because quite often you don't have PhD research scientists who know physicians who treat patients, or vice versa. No, a lot of the physicians don't know PhD research scientists. So I think the fact that you have people who are open-minded, who are really looking at the big picture, sort of say, like, we all have different areas of expertise and knowledge, but by working together, we have synergism. You know, like the little pieces together can make our progress much better. And I think the fact that we have these different pieces at our own institution is really great, which doesn't necessarily exist at other institutions.